on a ski accident. For shift report, the patient's name is Walter Smith. He is a 76-year-old Caucasian male, full code, primary language English. Reason for admission. This afternoon, Walter took a fall getting off the ski lift. He fell primarily on his left side and there was no loss of consciousness noted. He has severe left hip pain, 8 out of 10, left wrist swelling, and limited range of motion. He has a mild headache, dizziness, and denies nausea vomiting. His past medical history is osteoporosis, hypertension, and a prior fall 2 years ago with a right humerus fracture. He has an allergy to penicillin, and his home meds are lisinopril 20 milligrams daily, vitamin D3 daily, and acetaminophen as needed. His social history is he lives alone in a 2-story home, and his adult children visit often. He's a former smoker, retired firefighter, and physically active. His vitals: blood pressure 156/84, heart rate 92, temperature 83.3 degrees Fahrenheit, respiratory 18, and SpO2 97 on room air. What orders do you expect to be put in for Mr. Smith?
We could put in an order for diagnostic imaging for his hip and wrist. He said he didn't lose consciousness, but we should still be monitoring his mental status due to the headache and dizziness.
Maybe we could also put him on fall precautions, and probably he will need some pain medications to get his pain under control.
Yeah, definitely. Is there any other questions?
He's dizzy, but he states he didn't hit his head. When's the last time he's...
He said he hasn't eaten anything or had anything to drink since breakfast.
Okay.
Here's the provider's orders. His diet: he's a regular diet, NPO at midnight for the potential surgery of his hip. His activity is bed rest until the ortho evaluation, and he's on fall precautions. Diagnostics: MRI of his left hip, an X-ray of his left wrist, blood type and screen, and daily BMC or CBC and BNP. For meds, he has acetaminophen every 6 hours, morphine for severe pain, ice therapy to his hip and wrist as needed, and he'll continue his lisinopril and vitamin D3. What would you like to do next?
Maybe we can get the severe pain under control, monitor his vitals for any sort of changes, get a baseline of his neuro.
And what are the priority assessments we open?
Probably a neuro assessment, a pain assessment, maybe musculoskeletal assessment, and safety considerations.
So the assessment results: he has a mild headache, not worsening, dizziness present when standing up, his blood pressure is 111/70, pain 8 out of 10, worsening with movement, his left hip is limited range of motion due to pain, tenderness on palpation, and patient cannot safely bear weight, and there is some bruising. For the left wrist, there's swelling, limited range of motion, deformity, and bruising. And he scored a high on the Fall Horse scale. What do you think might be happening?
He appears to be having severe hip pain, wrist swelling, limited range of motion, so he could be having a potential hip fracture and distal radius fracture. He has a past medical history of osteoporosis, which increases the likelihood of a fracture. Also, he hasn't had anything to drink all day, so he might be experiencing orthostatic hypotension.
And what are you concerned about?
Most concerned about his safety. He has a high fall risk. We should be keeping the vital arm on, the call light and reach. Since he is older, he has some dizziness, so we shouldn't be allowing him to ambulate freely. He also lives alone, so we should be doing some discharge teaching. And since he has a past medical history of osteoporosis, his bones will be fragile, and so we should gently reposition him in bed.
And is there any more data you'd like to be gathering?
Yeah, possibly a neuro assessment. He has a headache, he is 76 years old, and he had a fall, and all of which elevates risk for intracranial heart bleed. But he also may be dehydrated, and he hasn't drank any fluids all day, and he's showing signs of orthostatic hypotension, and he has a history of hypertension, and is on lisinopril, so further action is definitely required.
Yeah. So there's new results that he does have a left hip and radial fracture, and there will be surgical intervention needed and casting. So what interventions would you like to do?
I'd like to start prepping him for surgery, so keeping him on NPO, placing an IV, getting some labs drawn, and probably applying some ice to the wrist and hip.
What would indicate that the intervention was effective?
If the pain decreases, example, like from an 8 out of 10 to like a 4 or 5 within 30 minutes to an hour. No falls or near misses occurring during the shift. Patient uses the call light appropriately. The swelling does not rapidly progress. The pulses remain strong and equal bilaterally. Dizziness improves with interventions and vital signs stabilize.
And what would indicate it wasn't effective?
Any signs of compartment syndrome, absent pulses, or any falls.
Okay, so now you walk into the room and you notice Walter is breathing faster than earlier. He states he feels short of breath. His respiratory increases to 24. His SpO2 drops from 97 to 92% on room air. He complains of sharp pain on the left side of his chest when he takes a deep breath. He appears slightly anxious. His skin is warm but slightly pale. His heart rate is now 104 and his blood pressure is 164 over 90. What do you expect is happening?
He might be having a pulmonary embolism, so this could be a result of his shortness of breath. He's experiencing chest pain, worsening with breathing. He is tachycardic, and his dropped in oxygen saturation. And he was recently immobilized due to pain and trauma, so this could be the reason why.
Yeah, and what are some interventions we can do for this?
Definitely notify the provider. Raise the head of the bed to improve ventilation. Apply 2 liters of oxygen. Stay with the patient, call for help if needed, and ensure he's on continuous pulse ox. Obtain a full set of vitals, and then anticipate a stat CT.
Yeah, anything else?
Maybe we look to see how that improves. So we want to make sure his oxygen saturation is above 95%. His respiratory rate we want it to be decreasing. We want him to report that he's having easier time breathing. We want his anxiety to decrease, his vitals to stabilize. And then if we confirm the pulmonary embolism, we want to start that anticoagulation, so like a heparin infusion, and increase that monitoring level and possibly move him to a step-down unit when possible.
Yeah. Alright, good job everyone.
Crossover!
Okay.
I was literally getting tickets for Wicked on someone's
She was sending texts with me.
I was like, hi.